12 signs you have low oxygen levels in your blood. Low oxygen levels in your blood, also known as hypoxemia, can reveal themselves in surprising and often overlooked ways. While some symptoms might seem minor, others can be serious indicators that your body isn't receiving the oxygen it needs to function properly. Because oxygen fuels every cell in your body, a deficiency can cause a ripple effect across multiple systems, leading to a variety of symptoms. In this article, we'll dive into the 12 key signs that may indicate your oxygen levels are too low. By understanding these symptoms and what they mean, you can take steps to protect your health and avoid serious complications. 1. Rapid heartbeat. When oxygen levels drop, your heart compensates by beating faster, a condition called tachycardia. This response is the body's way of trying to deliver more oxygen to vital organs. However, a persistently high heart rate places additional strain on your heart and blood vessels. You may notice your heart pounding or racing even when you're at rest. This can also cause chest discomfort or a feeling of anxiety. People with chronic conditions like COPD, chronic obstructive pulmonary disease, or heart failure are particularly vulnerable. Sudden causes, like lung blood clots or severe infections, can also trigger tachycardia. Left untreated, tachycardia increases the risk of complications such as arrhythmias or heart failure. If a rapid heartbeat is accompanied by dizziness, fatigue, or shortness of breath, seek medical attention. Treatment often involves oxygen therapy, medications, or addressing the underlying cause. 2. Excessive sweating. Unexpected or excessive sweating, particularly when it's not related to heat or physical activity, can be a sign of low oxygen levels. When the body is under stress, it releases adrenaline, triggering a sweat response. This type of sweating is often cold and clammy, and may be accompanied by restlessness or discomfort. Sweating due to oxygen deprivation is common in conditions like asthma, COPD, or during flare-ups of these illnesses. It may also occur in high-altitude environments, or as an early warning of carbon monoxide poisoning. In severe cases, excessive sweating signals hypoxemic shock, a dangerous state where organs begin to fail due to lack of oxygen. If you experience cold, clammy sweating alongside rapid breathing or a fast heartbeat, it's important to seek immediate medical help. 3. Cyanosis. Bluish skin. Cyanosis occurs when the skin, lips, or nails develop a bluish tint due to low oxygen levels. This happens when deoxygenated blood builds up in your body, giving tissues a blue appearance. It's most noticeable in thin-skinned areas like the lips, fingertips, and mucous membranes. People with darker skin tones may find cyanosis harder to detect, but it's often visible in the inside of the mouth or around the eyes. Causes of cyanosis range from sudden choking or asthma attacks to chronic conditions like COPD or congenital heart defects. Cyanosis should always be taken seriously. If it appears suddenly, it could indicate a medical emergency like a pulmonary embolism, blood clot in the lungs. Immediate treatment, such as oxygen therapy, can restore oxygen levels and prevent further complications. 4. Confusion or memory problems. The brain is one of the most oxygen-dependent organs, and when oxygen levels drop, it's often one of the first to show signs of distress. Confusion, memory problems, or difficulty concentrating can result from oxygen deprivation. Early signs include forgetfulness, trouble finding words, or difficulty following conversations. Severe cases might involve disorientation, inability to recognize familiar people, or an overall sense of being dazed. Confusion is often linked to chronic conditions like sleep apnea or acute problems like carbon monoxide poisoning. If confusion appears alongside symptoms like rapid breathing or bluish skin, seek immediate medical attention. 5. Euphoria or disconnection. One of the more unusual signs of low oxygen is a feeling of euphoria or detachment from reality. This happens when the brain isn't receiving enough oxygen, but the body temporarily compensates by releasing adrenaline and other chemicals. This symptom is common in altitude sickness and can make people feel overly confident or unaware of their declining condition. While euphoria might seem harmless, it's a dangerous sign that oxygen levels are critically low. 6. Visual problems. Low oxygen can impact your eyes, particularly the retina and optic nerve, which require a steady supply of oxygen. Symptoms may include blurry vision, tunnel vision, or seeing spots or flashes of light. These issues are often temporary, but can become permanent if oxygen levels remain low. Conditions like sleep apnea or sudden oxygen deprivation from carbon monoxide poisoning can lead to these visual disturbances. If you notice recurring vision problems, consult a healthcare provider. 7. Lightheadedness or dizziness. Feeling lightheaded is an early and common symptom of oxygen deprivation. Your brain requires a continuous oxygen supply to maintain balance and orientation. When levels drop, dizziness or a spinning sensation often occurs. This symptom may worsen when standing up quickly and, in severe cases, can lead to fainting. Chronic oxygen shortages from conditions like anemia or lung disease often cause lightheadedness, highlighting the need for medical evaluation. 8. Persistent fatigue or drowsiness. A constant sense of exhaustion, even after a full night's sleep, may indicate low oxygen levels. Without sufficient oxygen, your cells can't produce enough energy, leading to persistent fatigue. Muscle weakness and mental fog often accompany this symptom. Conditions like COPD, sleep apnea, or heart failure are common culprits. Addressing the root cause, such as with oxygen therapy, can help restore energy levels. 9. Nausea or vomiting. An upset stomach or frequent vomiting can be a result of oxygen deprivation. This occurs when the stomach and intestines receive insufficient oxygen, causing digestive distress. In some cases, the brain's vomiting center reacts to low oxygen, triggering nausea. If nausea or vomiting occurs alongside other symptoms like dizziness or fatigue, seek medical evaluation promptly. 10. Tingling or numbness in extremities. A lack of oxygen can cause poor circulation, leading to tingling or numbness in the hands, feet, or other extremities. This pins and needle sensation is often caused by disrupted nerve signals or reduced blood flow. Conditions like carbon monoxide poisoning or chronic lung disease frequently cause this symptom. Addressing oxygen levels and circulation can alleviate the discomfort. 11. Frequent headaches. Headaches, particularly severe or recurring ones, are a common but often overlooked symptom of low oxygen. The brain reacts to oxygen shortages by widening blood vessels, which can cause pain and pressure. Ignoring headaches associated with oxygen deprivation can lead to more severe symptoms, such as confusion or fainting. 12. Rapid breathing. Rapid, shallow breathing is your body's way of compensating for low oxygen levels. However, this can lead to hyperventilation and worsen symptoms like lightheadedness or numbness. Conditions such as asthma, pulmonary fibrosis, or high-altitude exposure often trigger rapid breathing. Stabilizing oxygen levels through therapy or ventilation can help. Final thoughts. Low oxygen levels can manifest in various ways, from subtle signs like headaches to more alarming symptoms like bluish skin or confusion. Recognizing these signals early can prevent serious complications. If you notice any of these symptoms, consult a healthcare professional to determine the cause and receive appropriate treatment. Oxygen is essential to life, and understanding these warning signs can help you protect your health and well-being. If you enjoyed watching this video, don't forget to like, subscribe, and turn on the notification bell, so you don't miss any new videos. Let us know your thoughts about this video in the comment section down below, and feel free to stay and enjoy it until the end. Also make sure to check out our next highlighted video, and we will see you next time. Thanks for watching. Please like, share, and subscribe.